BTEC Applied Science, Unit 5, Biology, Cardiovascular Disease. This is the third video about the cardiovascular system. CVD, cardiovascular disease, a general term. In other words, there's lots of things that it could refer to, but conditions that affect the heart and the blood vessels. Often caused by, and we talked about in Unit 1, atherosclerosis, which is fatty deposits in the arteries, which could ultimately lead to a blockage. But also brain and heart and kidney and eye damage can lead to types of CVD. Now, like all of your muscles, the heart muscles need a good supply of oxygen. So oxygen-rich blood, and it gets these from the coronary arteries. Okay, these are the arteries which supply the heart muscles. And if these arteries become blocked, or the blood flow through them is reduced, now angina is chest pain, pain in the chest, or ultimately, if these muscles don't get enough blood, then you could have a heart attack. You could go into ventricular fibrillation, okay? When the supply is suddenly blocked, you could have a heart attack. Risk factors. Some people are more likely to get problems, to get CVD. Genetics. There's an awful lot of diseases that, because of our genes, we are more susceptible to. Certain types of cancer and CVD as well. There are many diseases we are more susceptible to because of our genes, which we get from our parents. The older you get, the more at risk you are. Basically, we're only designed to live for a certain amount of time, and once you start getting to a certain age, bits of your body don't work as well. Gender. Men are more likely to get CVD at an early age. Diet. Okay, if you're overweight, then your heart is having to do so much more work. If you have a diet which is high in sugar and in saturated fat, okay, the sugar can damage your blood vessels. The saturated fat forms clots, and atherosclerosis is much more likely. High blood pressure is a big risk factor, which can be caused by a bad diet, or it can be caused by stress, or it can be caused by smoking. So smoking, nothing healthy. Whenever you smoke, you're putting a ridiculous number of poisons into your blood. There's nothing good for you about smoking. And inactivity. Inactivity, if you don't get enough exercise, then that will lead to obesity, that will lead to high blood pressure, and that is not a picture of me, by the way, that couch potato there. An experiment you should be familiar with, hopefully you had a chance to do it, is the effect of caffeine on heart rate. And the way that you do it is you use these water fleas called Daphnia, and you look at the water flea, you get it from pond water, you put it on a microscope slide, you dab away any water which it came with, but then you add, now you can add distilled water as a control, but then you add different amounts of caffeine to the water. And if you look at this water flea with a microscope, you can actually count the number of beats per minute. So you count the number of beats in 30 seconds, you do this every 2 minutes for 10 minutes, and you repeat the whole thing with different concentrations of caffeine. And you should get a graph that looks something like this. So caffeine, it's a kind of drug which is called a stimulant, and it increases your heart rate. Okay, and you'll see what effect the concentration has up to a limit. Above a certain limit, then the heart rate starts to go down for various reasons to do with the potassium or something in your blood. You don't need to know. But you should be familiar with this experiment, investigating the effect of caffeine on heart rate, which is what I do every morning, really. Now, treating CVD. There's various treatments, antihypertensives. Now, hypertension is the posh name for high blood pressure, okay? And it's a big risk factor. And if you can lower somebody's blood pressure by a relatively small amount, it can have a big effect on the chances of heart failure or stroke or other diseases. Now, there are various drugs that can do this. One of them is called a diuretic, and a diuretic helps the kidneys remove too much salt and water from the blood. But there is some concern about an increased risk of diabetes if you're taking diuretics. So antihypertensives. Statins, okay. Now, you should know about HDL and LDL, which is high density lipoproteins, low density lipoproteins. They say high cholesterol is good and low LDL is bad cholesterol. It's a bit more complicated than that. But anyway, statins help to reduce the amount of LDL in the blood. Some unpleasant side effects, particularly if you're taking other medicines as well. For example, it may cause muscle damage and headaches apparently as well, not feeling very well. So there are some not nice side effects from statins. Transplantation. We've got a slide all to itself. Heart transplantation. A damaged or failing heart is replaced with one from a donor who has died recently. So somebody is needing a new heart because their heart is damaged. They're on a waiting list. Somebody's been in a car accident and died, very sadly, but their heart is okay. And if they are carrying a donor card, then that means that the doctors at the hospital can take out their heart and put it into the recipient. Chances of success, 80 to 90% of people live for another year. 50% of people live for 10 years. Some people live for a long time, another 25 years. It's a very complicated and risky procedure. It's very expensive. It takes a long time to do, and an awful lot of things can go wrong. There's a shortage of healthy donors. There are a lot of people on waiting lists for transplant and there aren't enough donors. Not enough people carry a donor card. And consent is needed. You have to carry a donor card. Also, your immune system is likely to see this heart from somewhere else as something foreign, and your white blood cells are going to attack it. So you have to take drugs that suppress your immune system, so that your immune system does not see the foreign material as a threat, and you will have to take these drugs for the rest of your life, these immunosuppressants. And obviously, that will make you prone to infection. Okay, for the rest of your life, your immune system won't work as well as it should.